Hello. I would like to present you on One Health Eco Health project funded by Europe Aid, the European Union, that we are implementing in Southeast Asia currently. So my name is Aurelie Binot. I am an anthropologist and engineer in agronomy, working in Southeast Asia for more than 6 years now, in the framework of some partnerships with Thai government, Thai universities, Lao universities, and Cambodian universities and research centers as well. The name of the project I will present you today is Come Across, and Come Across is about the reinforcement of One Health partnership in Southeast Asia at animal environment human interface. Southeast Asia is a region that is really considered as a hotspot for the emergence of new health risks, claiming for the implementation of a One Health approach. Because, of course, Asia is the region with the fastest growing economy in the world, but also Southeast Asia is really a hotspot for emergence due to global change and rapid transitions. There is a drastic land use change. There are a lot of cross-border and national trade, rising urbanization, and a lot of environment change and biodiversity loss. And moreover, also there is a huge intensification in the agricultural production system and farming system. That kind of new health risk, of course, needs an approach in animal health and public health, but not only, because without involvement of social science, agricultural science, engineering, ecological science, and environmental science, and also the associated sectors in terms of governmental sectors, the environment, the agriculture, health, public health, of course, but also education, information, sometimes also the Ministry of Defense. A lot of different sectors are concerned and needed to address that kind of health risk. So there is really a need for better collaboration and cross-sectorial collaboration, interdisciplinarity also. But not only about sectors and government stakeholders. There are a lot of different stakeholders that are needed to be involved in that kind of new management schemes. And all of these different stakeholders will have different perceptions of the risks at play. And all of them will also have different knowledge. And all this calls for really a better networking among different stakeholders, for knowledge exchange, and for the co-design of a shared representation of the situation, the complex situation, in order to better manage that kind of health risk. So the purpose of our project was indeed to foster that kind of cross-sectorial and interdisciplinary collaboration through a better coordination among the different stakeholders, the laboratories, the research centers, the government, the civil servants involved or concerned by the health risk to be managed within a One Health framework. And in parallel, also, we promoted some studies and research in order to better understand the complex dynamics linked to pathogens emergence. So the project Come Across has been implemented within an EU program that is called Innovate, and that is really targeting One Health implementation in Asia, Southeast Asia and South Asia, but Come Across is focusing on Southeast Asia. And it has been implemented in parallel of another project that is called the Lacanet project, focusing rather on wildlife surveillance and biodiversity management in link with the emergence health risks. So these two projects, Come Across and Lacanet, are combining resources and expertise to implement One Health actions at the forefront of research and capacity building in the region by implementing an integrated, holistic, and operational approach. The objective of our project, Come Across, that is the project I am coordinating, is to implement an integrated One Health approach that will be operational in Southeast Asia by developing this holistic approach that is needed to better manage health among different stakeholders at the human, animal, and environment interface. So we are implementing a learning by doing approach to improve One Health and EcoHealth collaboration and practices. That means that the members, the stakeholders involved in this project are supposed to have a better understanding, a good understanding of what is One Health and EcoHealth, and about the frameworks and mechanisms that will enable a good communication and some routine collaboration at the animal-human environment interface. So we will involve what we call the One Health traditional stakeholders, being the veterinarians and the public health officers and medical doctors, but also the non-traditional One Health actors. That means people from social science, people from the agriculture, from environmental management, from wildlife management, all these stakeholders that are not health specialists, that are not the main One Health leaders, but that are totally needed in the process. So it means that we are developing a new culture of networking. And to achieve this goal, we are implementing an approach that is called participatory modeling, companion modeling. And it is a participatory approach based on modeling in order to share knowledge and risk perception and to co-design a shared representation of the situation. So we are combining a case study approach with capacity building. This case study approach means that we've targeted 3 countries, and in these 3 countries, being Laos, Thailand, and Cambodia, we are trying to better understand the eco-epidemiological interactions. What are the drivers of zoonotic disease emergence and transmissions? What are the social processes also, risk perception, local practice, and all the interactions among stakeholders that are key to better address these zoonotic disease and health issues. So our objective is really to develop a better research networking and to promote knowledge sharing and cross-sectorial collaboration through a program of One Health education. And this program of education is really combined to field activities, field-based activities through these case studies. So we are working on foodborne disease, we are working on water and waste management, we are working on vector-borne disease such as encephalitis, and through this model disease, these case studies, we are fostering the cross-sectorial collaboration and interdisciplinary research that is needed to better implement One Health actions. In this framework, in this approach, capacity building is really key, because having the field activities without strengthening the capacities of stakeholders to better understand and address the disease is not useful. So through the research, through the field research, we have identified step by step the gaps in knowledge and capacities of our colleagues and stakeholders involved in the project. So it means that in response to that, the identification of these gaps in capacities and skills, we have elaborated a capacity building program targeting, for example, better skills in GIS, all the visualization tools that are needed to foster the collaboration and to improve efficient research about that kind of health risk. So we are also strengthening the capacities of the stakeholders to implement a systemic approach. It means that through, for example, participatory rural appraisal, participatory epidemiology, but also risk mapping linked to GIS, better monitoring, also better capacities in laboratory diagnosis, and also all the modeling approach that are needed to better understand and characterize the epidemiology of this complex health risk and zoonotic disease. So this capacity building program has been really developed in parallel of the research, the field research and the case studies, to strengthen the capacities of the stakeholders involved in the case studies. In this capacity building program, we were really focusing also on how to have a good practice in data management, because One Health approach means that we will collect and analyze and manage data from different fields, from society, the data about the society and the social dynamics and the economics, etc. But also epidemiological data, but also biological data about biodiversity, all that kind of different data. So it's really heterogeneous, and we need to have a good capacity to integrate these different data within the same database, or database that can be combined. It means that we have to think about the integration between qualitative data and quantitative data, because of course social science will generate a lot of data that are not easy to integrate within a biological database. And in link with this data management, we are providing a lot of visualization tools, as I already mentioned, like GIS and all the capacities to elaborate risk mapping. It means also, on the lab point of view, that we need to have a strong barcoding and biobanking procedures in order to really manage this data properly, and to be able to share this data, to give access to this database in the framework of the participatory process that we are designing in this One Health approach. So our main expected results are to building a One Health community of practice with improved knowledge, networking facilities and skill, to have also an experiential learning from field to laboratory in order to have integrative multidisciplinary tools and methods and participatory approach, but also to disseminate the learning by doing approach to One Health actors. So we are really relying on participatory approach to reveal and strengthen the possible synergies between the various stakeholders that are involved, but also to enhance the knowledge of these stakeholders and their competence to analyze and manage zoonotic disease within a cross-sectorial and interdisciplinary framework. In order to foster this collaboration, this cross-sectorial and interdisciplinary collaboration, we need a strong methodology, a strong conceptual framework, because of course there is no magic blender that will blend together public health officers, communities, veterinarians, ecologists, epidemiologists, decision makers, etc., to have all together the production of a One Health best practice like magical. We really need methods for an improved sharing and cross collaboration. So in our case, the methodology that we are relying on is companion modeling, participatory modeling, and we use it to elaborate a conceptual model of socio-ecological interactions at work in a given complex system. So this approach will reveal step by step the cross-sectorial and interdisciplinary issues that we need to address. It will allow us to consider the different types of knowledge, of objectives and perceptions that are held by the different stakeholders to shape and share representation of the socio-ecological system. So we are within this socio-ecological approach of health. And also this methodology, either if we use conceptual models or agent-based models or role-playing games to involve different stakeholders, we can use computers or only conceptual model. But anyway, the stakeholders involved in this process of modeling will generate by themselves and play different type of scenarios. They will test different scenarios for health management. They will evaluate their strategies, and they will learn from themselves from this participatory process of modeling. They will learn about the consequence of their decisions, and then they will have a shared decision-making process. Such an approach is of course challenging because it is really time consuming, And that type of participatory approach involving, classical stakeholders, government officers, persons that are not used to be involved in participatory process, it will be really perturbing for them. And most of the stakeholders, or part at least of them, are very busy persons with official agenda, and it is difficult to have them available for half day or full day or 2 days of workshop. So this is really something that is challenging to manage. But also, it is difficult to co-design this shared representation of the socio-eco-epidemiological system, because there are always tensions between the dominant and non-dominant stakeholders. If you remember, I mentioned already that in One Health, the dominant stakeholders were veterinarians and public health persons. And when you have on the same table people from the environmental sector, agricultural sector, rural development, or communities, there can be some power games and some tensions among them. So this has also to be managed. The perception and representations that are driving behavior at local level are also often disconnected from the epidemiological perspectives and rationale and biomedical rationale. So this is also something that needs to be managed. But it is, of course, one of the objectives of such process. It is to merge together the knowledge of different persons, biomedical persons, but also communities and profane people with no real expertise in health, but that need to be involved in the process as well. And of course, the last challenge that is a recurrent challenge is to integrate social science in the process, within database, within all the different analysis process, because most of the time social science are generating narratives and qualitative data, and it is sometimes difficult to have an integrated analysis of the heterogeneous data produced by the different disciplines, and especially when social science are in the table, around the table. So it means that to perform that kind of participatory process, we need to be really flexible and to have an iterative work plan that will take into account all the expectations of the stakeholders, but managing the time and all these perturbing aspects that I have mentioned. So this project that I am presenting, Come Across, is about to be finished in a few months. And I can already tell you a bit about the key outcomes of this project. So first, we really achieved the building, the designing of interdisciplinary research teams in the 3 countries. And that was really challenging at the beginning, but we managed to have in the field and in the different workshops and training arenas to have researchers from different disciplines and stakeholders from different sectors working really together and being all together involved in this learning by doing experience. So they have developed new methodological skills. They have been following this new conceptual framework for their work. And this is really something that has been achieved from the village level to the national level. And especially in Laos, for example, where we had really a good connection between the national level stakeholders and very local level stakeholders for the management of parasitic from some neglected disease, parasitic zoonotic disease. So also we have improved the capacities of the stakeholders to have systems thinking approach. Systems thinking capacities that are really necessary to address One Health issues. And also we have a better acknowledgement of the local stakeholder perceptions toward risk and health risk, because most of the time we are still in a very top-down scheme. And in the case studies of this project, there was really taken into account of the risk perceptions of local stakeholders about that kind of disease. I can tell you a bit more about for example, what we've done in Thailand. In Thailand, we have organized a lot of stakeholders workshops that were aiming at highlighting the gaps in coordination between the sectors of agriculture, environment, and health at the level of 2 municipalities involving provincial stakeholders. And in this process, the local stakeholders' risk perception, especially about the health impacts of waste management, has been taken into account by the provincial officers. The project has provided scientific-based evidence, relying on epidemiological studies that we have implemented in the field, but also for the risk analysis and risk mapping of all these health impact of poor waste management at municipality level. And it has conducted to some actions taken by the provincial officers to, for example, close some landfills and promote recycling of some waste in the village, and training the health volunteers in some village with the communities to better recycle the waste and avoid these pollutions and risk of contamination from the waste to the waters, etc. In parallel with these waste management issues, the issue of stray dogs and the risk linked to rabies has also been something that has been a reason from the participatory process, because it is really something that is concerning the communities a lot. And so, thanks to the project also, the provincial officers have been involved in training of health volunteers in order to better manage the stray dog population, to vaccinate them, to have some counting, some awareness raising among the population for a better rabies management. So these inputs have allowed to modify the local policy at municipality and provincial levels to improve the local policies about rabies management and waste management, with some facilities that have been set up and with a lot of trainings among the communities and the health volunteers. We also had some interesting results in Laos, where through the studies and research that have been implemented at local level, we were able to grab the interest of some high-level national stakeholders from the Ministry of Public Health and the Ministry of Agriculture that have been elaborating on our results from our research at local level for the setup of an interministerial platform that will address this issue of parasitic foodborne disease that is really a neglected health issues in Laos, calling for a One Health approach. And so far there were no specific facilities targeting that kind of disease within a cross-sectorial framework. And so in parallel of the project, this interministerial platform has been set up, and it is really a great institutional impact from our action with local stakeholders. In this platform, there are people involved from 6 ministries in Laos, but also people coming from the provincial levels of some province of southern Laos that is really very much impacted by this neglected disease. So we have a cross-level platform involving officers from provincial level and national level that is quite innovating. And this platform is relying on some technical working groups that has been set up also to design interventions with local stakeholders. So we have implemented some deworming campaign, awareness raising campaign in the schools and at community level, but also sampling and diagnosis among animals and humans, because these are really zoonotic risks that needs the collaboration between veterinary services, agriculture sector, and public health officers at local level, with the great support of national level stakeholders. So I would like to share with you another result of this project in Cambodia about role-playing game. Indeed, in Cambodia, we worked really at local level with some farmers' communities, and the objective of our approach was to exchange knowledge between farmers and researchers about encephalitis, about Japanese encephalitis, and about Nipah virus. So through an approach based on a game, a role-playing game where farmers are playing about the land use and agricultural practice, they learn about risk factors and prevention measures that are linked to some encephalitis. And so through this game approach, we can also collect some data about the villagers' behaviors, about their perceptions, and it is really an exchange between the villagers and the scientists. And so we know better about their perception of the disease, and they know better about the epidemiology of this disease. And so we did the expected output of this tool, of this role-playing game, is to improve the implementation of prevention measures at the local level, so the encephalitis risk will be reduced. So finally, this project allowed us to really to formalize an operational framework and a conceptual framework to better manage health risk at human-animal environment interface. So our approach and the implementation of this conceptual framework allowed us to improve coordination and systems thinking capacities among the project stakeholders, to have an involvement of the non-traditional One Health stakeholders, from the local authorities to the national stakeholders, and to empower also most of these One Health stakeholders in order for them to better manage their local issues. And we have finally achieved this goal of considering that a healthy environment is a common resource that needs a better collaboration among local populations and with the good support from national institutions to maintain the environment as healthy as possible in order to avoid most of One Health risk. Well, thank you very much for your attention. Don't hesitate to contact us through our website or on my email address. And now I will share with you a short video about the Come Across project, so you will learn more about what we've done. Thank you very much. Bye-bye, and happy One Health Day.
Southeast Asia is booming, and the potential of lifting millions of people out of poverty is real, but fast and unplanned economic growth poses risks. This fast-growing region has become a hotspot for new and re-emerging infectious diseases. Environmental degradation is one of the top reasons for these rising health challenges. To understand potential solutions, we went to Laos, Cambodia, and Thailand to witness the work of the Come Across project.
Southeast Asia is really one of the hotspots at risk for emergence of disease at the human-animal environment interface. There is a lot of interactions and interrelation between animal health, human health, which is of course the main topic, but also environmental change. You know, like climate change, deforestation, intensification in agriculture.
Applying the One Health approach to deal with emerging infectious diseases is a leading way toward holistic thinking and collaborative work. This approach brings together medical, veterinary, and environmental science with a community-based orientation.
Multi-level actions, meaning empowering communities and having on the same boat communities, local stakeholders, local authorities, and high-level institutional stakeholders also. All together in what we call in COMACROSS the One Health community of practice. So what we do is reinforcing the capacities of all these people, from the village to the ministries, universities.
Southeast Asia is a recognized hotspot for occurrence and re-emergence of zoonoses, the term for diseases that are transmitted by animals due to close contact between livestock, humans, and wild animals.
So the pathogens, of course, the biological process are very important. But what really matters is to place this within the society.
We have 3 cases studied. One in Laos. In Laos, the issue that emerged from the stakeholder is a parasitic foodborne disease. And in Thailand, researchers, they thought that the flood is the issue. But when we proposed this to the stakeholders, no, it's not. Now the issue has been evolving, and now it's become the rabies. Amazing, huh? But in Cambodia, this is an exceptional case because it's totally come from the point of view of the scientists. It's about the Japanese encephalitis and Nipah virus.
For our case study, we focus on parasitic foodborne disease. Maybe the parasite from animal and environment contaminate in food and can affect to the human. So you have to cooperate, you have to work with other disciplines as well.
The solution will not be to avoid totally eating raw food. It is just to reinforce all the capacities to address this disease, together with the diagnosis capacities, control capacity, and also educating people and raising awareness.
In the Laos case, we plan to have the steering committee at the front line, 6 ministries, and they agree.
In Thailand, the project worked as a platform for voicing the concerns of the population regarding waste management and rabies, together with local and national authorities.
And we want to show them where is the landfill and where is the source of rabies.
COMACROSS ก็มีส่วนร่วมนะฮะที่มาสนับสนุนในเชิงวิชาการนะรวมถึงงบประมาณเพื่อเชื่อมโยงการทำงานทางด้านการจัดการของเสียรวมถึงสุขภาพของคนในชุมชน
COMACROSS is not about imposing a solution. The project is original because it combines interdisciplinary knowledge and participatory measures.
We have done many studies, ecological studies, sociological studies, on bats, on pigs, and on the local community. And now we are using role-playing games. It's a game where people can play their own role. So we can learn from them. And we can transmit our scientific knowledge through the game.
Yeah, exchange is very important. Exchange means we give information to the teacher and the teacher give information to us so that we learn from each other.
The overall goal of the COMACROSS project is to strengthen capacity for disease prevention and control involving more than the health sector, to include agriculture, environment, and local people. To sustain the One Health approach in Asia, the project developed training and capacity building activities to empower the next generation.
I think one of the things which is really a benefit for the student is they come here and they meet different experts and professionals from different fields, researchers but professionals from private sectors, and as well they share with students from the different countries.
For me, I'm going to come back to the country to contribute what I have learned to my students.
In my idea, I think is challenge for the student in Asia and also Southeast Asia, and you can learn the interdisciplinary culture.
What I learned is that flexibility, together with a rigorous methodology, can really lead us to some great achievement?
Je voudrais continuer le projet.
Personally, when I work with people, I do really hope not just try to squeeze out the scientific finding, but I really, from my heart, to make them perceive that this is the approach that can be practically done by them.